Norma frontalis. This Norma frontalis deals with the anterior aspect of the skull, which represents splanchnicranium or facial skeleton. It has following parts: the forehead, the bony orbits, anterior nasal aperture, malar prominences, and the teeth bearing upper and lower jaw. Frontalis can be studied under following headings. First, we take forehead. This forehead is completely formed by the squamous part of the frontal bone. Now, coming to the frontal bone, this frontal bone has two curved bony elevations. These bony elevations are known as superciliary arch, which lie over frontal sinus. The point which is known as glabella, this is the meeting point of two superciliary arches. As we run above, at either side of the middle point, or at either side of the middle of the forehead, there are two prominences known as frontal prominence or frontal eminence, which are more prominent in females and in children. Coming to lower part of the frontal bone, this frontal bone, as it joins with the two nasal bones, means that is at the frontonasal suture. This point is known as the root of the nose, and here on either side of the root of the nose, the two frontal bony parts are proceeding backward and forming the roof of the orbit, and at the junction, at the median point of the root of the nose, where the frontonasal suture and the internasal suture intersect, this point is known as nasion. Coming to the orbits, there are a pair of orbital cavities which in outline are quadrangular in shape. These orbital cavities are having four margins. One is upper margin, lower margin, medial margin and lateral margin. This upper margin is known as supraorbital margin. It is mainly formed by the curved plate or the frontal bone. At the junction of medial 1/3 and lateral 1/3 on supraorbital margin, there is a notch or there can be a foramen which is known as supraorbital foramen or supraorbital notch. From here, supraorbital nerves and vessels transmit, and medial to this supraorbital notch or supraorbital foramen, there are supratrochlear nerves and vessels which run upward in the forehead region. Coming to the lateral wall is formed by two bones. The major portion is formed by the zygomatic bone. Here we can say that it is the frontal process of the zygomatic bone which forms the major portion of the lateral wall of the bony orbit, and the minor portion, it is formed by the zygomatic process of frontal bone. So two bones, that are zygomatic bone and frontal bone, which forms the lateral margin of the bony orbit. Coming to infraorbital margin or lower margin of the bony orbit, it is formed by two bones. The medial portion, it is formed by the maxillary bone or maxilla, and the lateral portion is formed by this zygomatic bone or cheek bone. Coming to medial margin, this medial margin is ill-defined and it is also formed by the two bones. One is frontal bone from above and the other bone is maxillary bone, in which the frontal process of maxillary bone forms the medial margin. So mainly two bones are forming the medial margin. First is frontal bone and the other one is frontal process of maxillary bone. Coming to lower part of face, or the cheeks, these are formed by the malar prominences which are formed by the zygomatic bones. This zygomatic bone is having three surfaces. One surface is anterior surface. This anterior surface is convex and it has a foramen known as zygomaticofacial foramen. Through this foramen there is transmission of zygomaticofacial nerve, which is a branch of zygomatic nerve. Coming to next surface, the next surface of the zygomatic bone is orbital surface. This orbital surface is forming the lateral part of the floor of the orbit. And the last surface is known as post-temporal surface. This temporal surface is grooved and it is grooved for the temporal fossa and temporalis muscle. This zygomatic bone has two processes. One process is known as frontal process of the zygomatic bone, which is forming the lateral wall of the bony orbit, and it is fused with the zygomatic process of the frontal bone and forming frontozygomatic suture. Now coming to another process of this zygomatic bone, this process is running backward, and this process is known as temporal process of zygomatic bone, and this is fused backward with the zygomatic process of the temporal bone, and this completes the zygomatic arch. Here in this zygomatic arch there are two borders. One is upper border and the other one is lower border. Upper border, if we trace it in upward direction, it represents an italic F letter, and if we trace the lower border, it presents a bony ridge which terminates in the upper second molar tooth. Now the next structure which is contributing to Norma frontalis is anterior nasal aperture. This anterior nasal aperture is pyriform in shape. That means the upper portion is narrow and the base portion is broad. The boundaries of this anterior nasal aperture, in upward portion, the lowermost margins or the free margins of the two nasal bone, that forms the upper margin, and the lower and lateral portion, these are formed by the two maxillary bones. Articulations of nasal bone. Here in anterior aspect, one nasal bone is articulating with the opposite nasal bone. Superiorly, one nasal bone is articulating with the frontal bone, and posteriorly the nasal bone is articulating with the frontal process of maxillary bone. And in the anterior nasal aperture, a projection in the median portion is raised or is projected from the two maxilla. This projection is known as anterior nasal spine, which supports the septal cartilage of the nose. Now coming to the maxilla or upper jaw, which forms the greater share of the facial skeleton. In this, it is formed mainly by the two maxillary bones. The maxillary bone is pyramidal in shape, and it has four processes known as frontal process, which is running upwards. Other one is alveolar process, which is running downwards, and in the alveolar process, which bears sockets for tooth, and it forms dentile arch for 16 tooth. Coming to the third arch, this is known as palatal arch. This palatal arch is running horizontally and it meets with the opposite palatine process of the opposite maxillary bone, and it forms the major portion of the hard palate. And the other process is known as zygomatic process, which is fused with the maxillary process of zygomatic bone. And this maxillary bone has also got four surfaces. One is anterior surface. The anterior surface presents a foramen which is known as infraorbital foramen. This infraorbital foramen is 1 centimeter below this infraorbital margin, and here the infraorbital vessels and infraorbital nerves emerge. Coming to another surface which is known as nasal surface. This nasal surface is forming the lateral wall of the nose. Coming to next surface is known as orbital surface, which this orbital surface forms the medial part of the floor of the orbit. And another surface is posterior surface, which is not seen in this skull. This posterior surface forms the anterior wall of the temporal fossa and pterygopalatine fossa. Coming to lowermost portion of the facial skeleton or the Norma frontalis, this is formed by the mandible. This bone is horseshoe shaped bone and it has a broad base and a quadrilateral structure which is projecting upward in direction and from the dorsal end of the body of the mandible. Now, the body of the mandible has got two surfaces. One is external surface and the other one is internal surface. And it has two borders, upper border which is also known as alveolar border and the lower free border which is known as the base. Now, this mandible has two foramen on the external surface. These foramen are known as mental foramen. From this, mental nerve and vessels run. And on the front side, developmentally, the two right half and left half of the mandible, they develop separately, and at about 2 years of age, they fuse at symphysis menti. And at symphysis menti, there is a protuberance known as mental protuberance. This is triangular elevation, this is known as mental protuberance, and at the lateral angle of this mental protuberance, these lateral angles are known as mental tubercles. These mental tubercles run obliquely upward and it merges with the anterior border of the ramus of the mandible. Coming to ramus of the mandible, which is quadrilateral in shape and it has two surfaces. One is lateral surface and the other one is medial surface. And it has two borders, anterior border, posterior border and superior border. Anterior border continues with a process known as condylar process. Now the ramus of the mandible is having three borders. One is anterior border, another is posterior border and the last border is superior border. This anterior border continues with the coronoid process. The posterior border is continuous with the condylar process. In this, the condylar process is having a head which articulates with the mandibular fossa of the temporal bone forming TM joint, and it has a constricted neck. And the superior border is having a notch known as mandibular notch. The median point on the base of the mandible is known as gnathion, and the angle of the mandible, the point on the angle of the mandible is known as gonion. Now collectively, if we see the anterior aspect of skull, we can see that there are 5 foramina. One is superior orbital foramina, another is infraorbital foramina, and third is mental foramina, fourth is zygomatico-facial foramina, and the fifth one is mental foramina. Now collectively, if we see the anterior aspect of the skull, we can see that there are 5 pairs of foramina in the anterior aspect of the skull. From above downwards, we can see the one is supraorbital foramina, another is nasal foramina, next is infraorbital foramina, next is zygomatico-facial foramina, and the other one is last is mental foramina. Now, the superior orbital foramina, inferior orbital foramina and the mental foramina, they almost approximate in one line, and they are also supplied by the trigeminal nerve branches. That means the supraorbital nerve, they are the branch of ophthalmic division of trigeminal nerve. Infraorbital nerve is a branch of maxillary division of trigeminal nerve, and the mental nerve is a branch of mandibular division of trigeminal nerve, and the other is zygomaticofacial foramen, which transmits zygomaticofacial nerve, which is the branch of zygomatic nerve, and the last is nasal foramina. This nasal foramina, it transmits nasal vein only. Thank you. Hope you understood well. This nasal